Welcome, everyone. Thank you for joining us today at our General Medical Plan Benefits Overview for active employees and non-Medicare retirees. We're happy to be here with you. We have representatives today from our health plans as well as our vision plan, as HSS administers both health and vision for Unified School District employees. So today they'll be in our Q&A comments, being able to answer questions as they come in. Just so you know, your microphones are going to be muted during the entire webinar. So we encourage you to ask the questions through the Q&A channel in your menu bar. And the presentation that we're going to start is pre-recorded, and it allows all the plan representatives to focus on the questions, which, like I said, is going to be active while that video is running. So go ahead and pop in there. And then at the end of the presentation, we'll be able to hear from our representatives as they've answered those questions. We'll go back through the Q&A channel, start from the beginning, and make sure each one of those questions are answered. We will promptly end at the top of the hour, just to respect everybody's time. And with that, we'll get started. We'll transition over into the video, which will just take a moment. Welcome to the San Francisco Health Service System Open Enrollment webinar. We're so glad you've joined us today to learn about your benefits for Plan Year 2026. Open enrollment is a period each year when all members can enroll in benefits coverage and change their current benefits coverage for the upcoming calendar year. You can change from one plan to another, enroll or waive coverage, add remove dependents from coverage, enroll in flexible spending accounts. If you do nothing, your current year benefit elections will roll over to the next plan year. However, flexible spending accounts do not roll over. Eligible members must re-enroll in the flexible spending accounts each year to participate. Your new benefit choices are effective January 1st, 2026. Open enrollment starts at 8 a.m. on Wednesday, October 1st, 2025, and ends at 5 p.m. on Friday, October 25th, 2025. You may enroll online at SF My Hub, located at sfhss.org. How to enroll. Find the open enrollment tile to access the My Health benefits to make your new benefit elections. City and county employees can also access SF My Hub through the SF My portal. Paper applications must be postmarked by October 24th, 2025 to be accepted. You'll be on mute and off camera for the entire presentation. We encourage you to ask questions. We will be using the Q&A function in Microsoft Teams. Scroll through your screen to find the menu bar, either at the top or bottom of the screen, depending on whether you're using your computer or mobile device. Click on the Q&A icon in your menu bar. Click on Create Post to type your question. We will answer as many questions as time allows during the Q&A session. Please do not share personal medical information in the chat. Everyone can see it. We recommend a one-on-one consultation. If you have questions that do include personal and private medical information, please schedule a private one-on-one consultation with a health plan vendor. Our health plan vendors have open enrollment office hours. To schedule an appointment, visit sfhss.org/OE2026. If you have eligibility questions, please call SFHSS Member Services at 628-652-4700 or visit our offices at 1145 Market Street, the third floor, during our business hours listed on the screen for further assistance. And we want to remind everyone to get their annual flu shot and COVID booster to protect yourself and your loved ones this fall and winter. With that, our presentation will now begin.
Good afternoon, everyone. Thank you for joining us today for this webinar to kick off your 2026 open enrollment. This is now the 5th year of our HealthNet Canopy Care HMO plan being offered, and we're excited that you've joined us for this webinar to learn more about the plan and all the wonderful programs that come with it. But first, quick introduction on the speakers. My name is Fred Reyes, and I'm representing HealthNet. And with me today, I have Emma Welch, who is representing the Medical Network. And combined, we're able to offer City and County of San Francisco employees, as you can see here, our powerhouse Canopy Care HMO medical plan. Next slide, please. So I'm going to hand the presentation over to Emma now to walk you through the partnership that was created between HealthNet and Canopy Care. So Emma, I will hand it off to you.
Thanks, Fred. So the HealthNet Canopy Care HMO offers you and your family an affordable way to access the Canopy Health Network. And the Canopy Health Network includes some of the best hospitals and medical groups here in the Bay Area. And as a UCSF Health affiliate, Canopy Health does offer access to the UCSF physicians and hospitals. So, in addition to UCSF, we do have 5 medical groups you'll see listed. So, John Muir Health, Health Physicians, SCIPA, Dignity Health, and Providence, 30 hospitals, and over 100 urgent care centers. And then, as you can see on the map, we are in all 10 Bay Area counties. So, we're in Sonoma, Napa, Marin, Contra Costa, Alameda, San Mateo, and Santa Cruz, and then partially in Solano and Santa Clara counties. Network features. So we do offer over 5,000 providers, 30 Bay Area hospitals, as mentioned. We have a world-class academic medical center with UCSF Health. We offer an Alliance referral program, which I'll explain a bit more in the next slide, and then 24/7 virtual urgent care with the doctor. The Alliance referral program is unique to Canopy Health. It gives you the choice to access specialists outside of where your primary medical group is. So in most HMOs, you can only get your care within your medical group, but Canopy Health gives you access to all our specialists to find one that is right for you, even those outside of your medical group. So there is a bit of a process with it. So first, you'll meet with your primary care doctor to explore options. And then if you both decide that a specialist is needed, um, you and your doctor will discuss what the best option is within the network. From there, your doctor will send a referral request to your medical group's referral department. And then once that referral is approved, you and your specialist will be notified. And then from there, once it's approved, you are free to schedule an appointment. And then if you do have any questions specifically about the Alliance Referral Program, we do have a dedicated email, and that you'll see listed on the slide as challiancereferrals@canopyhealth.com. For what's new this year, so lower rates is one of the most affordable options. Canopy Care continues to offer you and your family access to the same high quality hospitals and medical groups. For network news, I think we shared this last year, but just wanted to share again that the UCSF and John Muir Cancer Center in Walnut Creek opened last year in February. And the UCSF Bayfront location opened about a year ago. There is an urgent care at this location. It's open 7 days a week from 8 a.m. to 8 p.m., and walk-in appointments are available. And then Teladoc Health, telehealth services. You can talk to a healthcare provider through a virtual visit when you're not able to see your primary care doctor, and they can help with everyday non-emergency conditions. So, like the flu, stomach bugs, sinus infections, and more. And then I'll hand it back over to you, Fred.
Thank you, Emma. So before we move on, you're going to hear me mention our dedicated website throughout this presentation, and that is healthnet.com/SFHSS. And if you're exploring options, you can visit this site to learn more about HealthNet and what we offer. And if you're an existing member, remember you have access to many online tools. Next slide, please. So next, we're going to talk about our behavioral health solution we offer our city and county employees. Next slide. So I won't go everything that's over this slide here, but when it comes to access to care, we have you covered. We have over 22,000 in-network behavioral health providers, with over 5,000 of these providers accepting both in-person and virtual care. We have a 24/7 call center, integrated care management program. And so what that basically means, if you ever need any higher level of care, your primary care physician and your therapist work together to make sure you get the proper care. Next slide. So this is a quick benefits at a glance of your behavioral health benefits. Important to note that no referral or authorization is needed for any outpatient office visits. Co-payments for outpatient care is a $25 co-payment. Higher level of care, that would be inpatient admissions, that would be $200 per admit. And then outpatient services, that is covered at 100% under the plan. Next slide, please. All right, so next we're going to go over our alternative medicine benefits, which include acupuncture, chiropractic, and massage therapy. Next slide. So our acupuncture and chiropractic network is through American Specialty Health. They also go by ASH, ASH. No referral is needed from your primary care physician to access this network. You can self-refer directly to any ASH provider, and you're only responsible for fixed co-payments, which will go on the next slide. And so here you can see again, no referrals or authorizations needed. For routine chiropractic care, it's a $15 copayment for up to 30 visits per calendar year. For routine chiropractic care, $15 per visit. Again, a separate 30 visits per calendar year. And then for massage therapy, we offer a 25% discount on fees from network massage therapists. Next slide. Now, in the next couple of slides, we'll cover our wellness programs as well as our value-added programs, most of which are free and zero cost to our members. Next slide. So first up, we have our Real Age test. This is a personal risk assessment where you can earn a $50 gift card just for taking the test. It takes no more than 10 minutes and up to $50 more for completing other healthcare activities such as sharing the results with your primary care physician. We already talked about telehealth or teledoc virtual health and WellVie, which is our decision support program that helps our members decide on, prepare for, and recover from surgery. Members can also earn a $25 e-gift card just for completing a couple of the program modules. Again, just to simply learn about what WellVie is. Next slide. Now, we do have some behavioral health wellness programs as well, and we provide a great self-help program for our members through Teladoc Mental Health, that digital app, which provides support for stress, depression, sleep, and more. And then Unwinding, which uses mindfulness to help our members build resilience. So members are able to use it throughout the day whenever they find themselves feeling stressed or if they need to get a quick dose of calmness. Through the use of breathing exercises, meditation, sleep support, and visual relaxation, members can start experiencing less stress in their life. Next slide. And the last two programs we want to cover from this section is our gym fitness membership discount program through Active and Fit, and as well as our healthy discount program that allows members to purchase items at a discounted rate, such as vitamins, hearing aids, eyewear, the massage therapy discounts that we previously mentioned, as well as weight loss memberships. Next slide. Now, in the next couple of slides, we'll cover what you can expect when changing plans. So first, we'll cover the medical basics. So reminder, HealthNet does auto-assign you a provider for the upon enrollment. However, you have 90 days to make that correction. So if you actually have a primary care physician that you're currently seeing, that's within the network. We can definitely make that correction back to the 1st of January. Now, if you are someone who's seeking care with the provider currently, that's not part of the HealthNet Canopy Care Network. We offer our members continuity of care. So that's in a situation where a provider, again, is no longer in our network, or a member has a qualified condition, or there's a pre-existing provider relationship. There's a form that gets filled out, and there could be the possibility to continue care with that non-contracted provider for an extended period of time. And for non-urgent care appointments, we do, these are hard to come by between the months of January and March. So it's always a good idea to make sure you schedule an appointment early on, confirm availability of your doctor as soon as you can, or when you get those HealthNet ID cards around the beginning of January 1st. Next slide. Now, in terms of the pharmacy program basics, again, we strongly encourage members to identify the new drug list, the differences in prior authorization requirements, and the cost share differences. And to assist with this, we've designed a benefit member guide on our website, again, healthnet.com/SFHSS, to help members easily understand the drug list and, again, where their drug may fall under in terms of prior authorization or quantity limit requirements. Now, it's very important to understand that prescriptions, authorizations, and clinical criteria notes, those don't get transferred to a new health plan. But in order to avoid any issues with your current prescription or any self-injectables, members are able to complete HealthNet's prescription transition form, which is available again on our website. And that would allow the information of that previous prescription with the previous health plan to carry over to HealthNet. Next slide. And now we want to cover some access to care alternatives very quickly. So in the next slide, you'll see here, again, Teledoc, which we already covered. This is a great program to access, especially for those members who may have college students or if they're traveling. Teledoc is available 24 hours, 7 days a week, and available anywhere in the US, again, while traveling. And we also have a nurse device line for our members, and that aims to reduce avoidable ER visits. Now, one thing I do want to mention is since our canopy plan is an HMO model, all routine care does need to be provided back in that Bay Area service area. Next slide. And one final important thing to let you know about is our open enrollment office hours. This is your opportunity to schedule an appointment and talk with one of our customer service agents about any questions or concerns you may have about our plan, or if you're considering making a switch to Health Net Canopy Care. The calendar link to schedule an appointment is available again on the top banner of our dedicated website. You just click the time and date that's most convenient for you. Next slide. And so as we close, we want to summarize why someone would want to consider choosing Canopy. And again, we provide affordable access to some of the best hospitals and medical groups in the Bay Area, easier access to specialists through the Canopy Health Alliance referral program that we covered at the beginning of the presentation. Canopy is a network of choice for many doctors, nurses, and families around the Bay Area. And last but not least, HealthNet's whole health member-centric programs and services that we covered, which are intended to support our members' physical, behavioral, and emotional well-being. So this concludes our presentation. We just want to thank you again for your time today. We hope you found this presentation helpful. And again, we wish you good health in 2026. Thank you.
Good afternoon, and thank you for joining today. In this presentation, we will be going over, at a high level, the Access Plus, TRIO, and PPO plans available to San Francisco Health Service System members, effective January 1, 2026. Let's begin by taking a quick look at the Access Plus and TRIO plans. SFHSS members have the option of two HMO plans, Access Plus or TRIO. The Access Plus and TRIO plan benefits remain the same from 2025 to 2026. Both HMO plans require you to choose a primary care physician or PCP. These PCPs are associated with an Independent Physician Association or IPA, often referred to as a medical group. Members must stay within their chosen IPA for all services. Both the Access Plus and TRIO plans have fixed copays for most covered services. The benefits for both Access Plus and TRIO are the same, with the network being the only difference between the two plans. The TRIO network is a subset of the Access Plus network and is only available in select regions of California, whereas the Access Plus network is Blue Shield's full HMO network and is available throughout the state. Access Plus and TRIO members have access to virtual medical and mental health care via Teledoc at a $0 copay. Access Plus and TRIO members also have access to an extensive pharmacy network, including all the major chains such as CVS Pharmacy, Walgreens, and store locations such as Walmart and Costco. Members also have access to Amazon Pharmacy's home delivery of prescription medications for 30, 60, and 90-day supplies. Access Plus and TRIO members can get answers to their questions about plan benefits, ID cards, provider network, claims, medications, language assistance, condition management, and more by connecting directly to their certified team of healthcare experts via Shield Concierge. The Access Plus and TRIO plans include coverage for emergency and urgent care services only when traveling. The Blue Card program expands your service area, giving you access to hospitals and urgent care providers almost everywhere. Also available to members' dependents who attend school outside of California is the Away from Home Care program. The program provides convenient healthcare coverage while temporarily residing in another state. To learn about your specific out-of-area healthcare coverage, members should call a Blue Shield Away from Home Care specialist at 800-622-9402. Taking a high-level look at the benefits for both Access Plus and TRIO plans, you'll see the benefits are the same. As previously advised, the benefits are the same for both plans, with the network being the only difference between the two. Both plans have no deductible with an out-of-pocket maximum of $2,000 individual and $4,000 family. Both have a $25 copay for PCP visits, $30 copay for specialist visits with lab work, and teledoc at a $0 copay. Outpatient surgery in hospital is $100 per surgery, and inpatient hospitalization is $200 per admission. Both have chiropractic and acupuncture benefits at $15 per visit, up to 30 visits per member per plan year each. There is no pharmacy deductible for either plan, with retail drug copayments of $10 generic, $25 formulary brand, and $50 non-formulary brand. Home delivery is available for 2 times the retail copay. Programs available to Access Plus and Trio members include the following: Shield support, nurse support, home visits, self-management tools, and workshops to help members with a variety of conditions. Nurse help 24/7, immediate answers to health questions from registered nurses available 24 hours a day. Maternity program, offered through Maven, provides virtual care support if you're pregnant and up to 3 months postpartum. Life referrals 24/7, available for simple questions like quick ways to de-stress or how to find more time in your schedule, to more difficult issues like finding support after the loss of a loved one. There are a couple of programs offered exclusively to Trio members only. Non-emergency transportation for eligible Trio members recovering from a serious illness. This program offers reliable transportation to and from medical appointments. Free meal delivery for eligible Trio members is a convenient and nutritious meal delivery service for members recovering from a serious illness. The program offers prepared meals geared towards special dietary requirements. Eligibility for both programs is determined by a Blue Shield case manager. To learn more or to see if you qualify for both or either program, members should call Shield Concierge at 855-747-5800. Now, let's look at the PPO plan. SFHSS members have the option of selecting the Blue Shield of California PPO plan. The PPO plan benefits remain the same from 2025 to 2026. The PPO plan utilizes the Blue Shield of California PPO network. Members have the option of using an out-of-network provider for a higher cost share. This allows members the option to see any doctor of their choosing, both in or out of Blue Shield's network. The PPO plan is also available nationwide. If accessing doctors or facilities in other states, members would utilize the local Blue Cross Blue Shield plan of the state they're in when searching for a doctor or hospital. PPO members have access to Blue Shield Connect, which includes access to customer service representatives and a dedicated care manager who are available to assist members with questions they have, from helping find a doctor, finding treatment options, assisting with authorizations, setting health goals, and coordination of care. Here's a high-level look at the PPO plan. The Blue Shield of California PPO plan is a coinsurance-based plan with a deductible that must be met before Blue Shield, as the plan, pays anything. The deductible for an individual is $250 and $750 for a family in network, or $500 individual and $1,500 for a family out of network. PCP, specialist, lab work, teledoc, outpatient surgery in a hospital, and inpatient hospitalization are all 15% in network after deductible, or 50% out of network after deductible. Chiropractic and acupuncture are both 50% up to $1,000 maximum per member per calendar year after deductible. There is no pharmacy deductible, with retail drug copayments of $10 generic, $25 formulary brand, and $50 non-formulary brand. Home delivery is available for 2 times the retail copay, in network only. Programs available to PPO members include the following: Maternity program, offered through Maven, provides virtual care support if you're pregnant and up to 3 months postpartum. Life referrals 24/7, available for simple questions like quick ways to de-stress or how to find more time in your schedule, to more difficult issues like finding support after the loss of a loved one. Now, let's look at mental health resources offered to HMO and PPO members. Let's start by talking about a change to Behavioral Health Administration that will impact Access Plus and TRIO members. Magellan will continue to provide mental health services until December 31st, 2025. Beginning on January 1st, 2026, Blue Shield will provide these services to Access Plus and TRIO members. The vast majority of behavioral health providers are already part of Blue Shield's network. Beginning in October, members seeing providers who are not in Blue Shield's network will be receiving information on how to make a request for continuity of care. If you have received an authorization for behavioral health or substance abuse treatment that carries over into 2026, it will be honored. SFHSS PPO members will continue to access the Blue Shield of California network for all their mental health services. SFHSS members have access to 3 virtual care programs. Teledoc, where members can make virtual appointments with behavioral health providers between 7 a.m. and 9 p.m. Pacific Standard Time. Members will need to have a Teledoc account before attempting to schedule an appointment. To register, members should go to blueshieldca.com/Teledoc, click the login link, which will take them to the member login and registration page. To register, members would click on the Get Started button and follow the directions. If you already have an account, members will simply log in and then proceed to schedule their appointment. Next, Nurse Help 24/7 can be used for referrals to providers or county mental health resources. Only available to Access Plus and TRIO members. Finally, Life Referrals 24/7 connects members to licensed therapists, 3 sessions in any 6-month period. SFHSS members also have access to Headspace and Headspace Care. Members can visit wellvolution.com/mental health for additional information. Credible Mind empowers everyone's mental well-being. Anyone can access Credible Mind without logging into the Blue Shield portal to view resources, articles, and questionnaires. However, by creating an account with Credible Mind, members can save questionnaire results and opt in for ongoing engagement, including content and topical newsletters. Next, let's talk about pharmacy benefits and the SFHSS microsite. SFHSS members have access to a redesigned pharmacy hub within the member portal that makes it easier for members to view and manage their prescriptions. With the new Price Check My RX tool, members can find the lowest cost option pharmacies and home delivery options when available. Members opting in to push notifications receive mobile alerts for prescribed drugs during a doctor visit and when a lower cost option is available. Members will continue to enjoy a robust retail pharmacy network, which includes national chains such as CVS Pharmacy and Walgreens, plus independent pharmacies and discount grocery store locations such as Walmart and Costco. Amazon Pharmacy Home Delivery is available for prescription medications for 30, 60, and 90-day supplies, or more if available. SFHSS members can also continue to utilize CVS Specialty for 30-day supply for specialty medications. SFHSS members have 24/7 access to all their plan information with their dedicated Blue Shield SFHSS microsite. Members can find overviews of their plans, plan documents, links to find a doctor, and details on programs and services. To access the microsite, SFHSS members can go to blueshieldca.com/SFHSS. Simplify your life and go digital. By registering online, you have access to features like your digital ID card, benefits, claims, plan status, finding a doctor, and more. Go to blueshieldca.com/register to complete your registration. If you're an Access Plus or TRIO HMO member, be sure to register with your medical group as well. Registering allows for easy access to your medical group's online portal and the many features it will open to you. SFHSS members can find doctors, specialists, hospitals, and pharmacies for both the HMO and PPO plans by accessing the following. For Access Plus, members would go to blueshieldca.com/network HMO. For Trio, members would go to blueshieldca.com/Trio SFHSS. To find providers in California, PPO members would go to blueshieldca.com/network PPO. To find providers outside of California, PPO members would go to provider.bcbs.com. Now let's take a few minutes to explore Wellvolution. Wellvolution is a digital platform that guides members 18 and older on their health journey. Wellvolution customizes members' path to better health, matching them with clinically proven programs and apps that are right for both their mind and body. Through Wellvolution, members have access to lifestyle-based tools and support designed to help them lose weight, treat diabetes, nurture mental health, and more. Members get personalized plans, on-demand tools, and health coaches to assist them in reaching their goals, all at no extra cost. Members can get started by going wellvolution.com. Wellvolution offers 6 paths for members' health journeys. Weight management and diabetes prevention, offering personalized support to lose weight, improve overall health, and feel better with programs offered by Weight Watchers, Better, Personify Health, and more. Diabetes management with Dario, offering vetted methods to help control type 2 diabetes and limit your risk of chronic disease. Also with Dario, blood pressure management, offering at-home blood pressure management program for a healthier heart. Stress and sleep management, supporting your well-being with app-based therapy sessions, behavioral health coaching, meditation, and mindfulness programs with Headspace and Headspace Care. Tobacco cessation, helping members break the habit with tested strategies that help you beat nicotine cravings and addiction with EX program and Life. Fitness and physical therapy, to relieve joint and muscle pain and increase strength and flexibility with app-based physical therapy, ergonomic support, and a PT finder with Swore Kid Health and Kaya Sword. I want to thank you for joining today to review your SFHSS Blue Shield benefits and programs offered for the 2026 plan year. Thank you again, and have a great day.
Hello and welcome. To find your healthy place, you and your family need high-quality care that is simple and personalized. At Kaiser Permanente, we're both a care provider and a health plan which makes your life easier. Today, I'll be highlighting our integrated quality care, digital care options, and membership perks. This shared information will help you select with confidence the right health plan for you and your family. Before we start, please tell us what you think. We invite you to complete a 2-question survey at the end of the presentation, which will take less than a minute to complete. Now, are you ready to get started? Great, let's begin. Kaiser Permanente provides high-quality care designed for your total health. That includes care for routine checkups, complex treatments, and mental wellness, and care for building strength, reducing stress, raising a family, and new goals. No matter what your priority is, ours is providing excellent care when and where you need it. Your doctors, hospitals, and health plan benefits work together to give you exceptional care when and where you need it. Everything is connected, so when you get care in person or virtually, your doctors have access to your entire health history and can pick up where you left off. You have 24/7 access to care wherever you are, from virtual care, video, and phone visits to in-person appointments. You can choose how, when, and where to get care, plus stay on top of your care 24/7 with the Kaiser Permanente app or at kp.org. If you prefer to visit in person, same day, next day, and weekend appointments are available at most locations, and many facilities have labs and pharmacies in the same building. We support your mental health and wellness because your mental health and lifestyle are essential to your total health. Kaiser Permanente includes many resources for self-care at no extra cost. Take advantage of popular self-care apps to help reduce stress, improve sleep, and manage overall mental wellness. Get high-quality preventive, primary, and specialty care with most plans and a wide range of preventive care at no extra cost. If you need specialty care for maternity, cancer, heart health, or anything else, you have access to cutting-edge technology and the latest evidence-based care, and you can change your doctor at any time, so you always have a health partner you know and trust. We're all used to getting instant information on our phones. When it comes to healthcare, there's a lot of noise to sift through. If you have a health question, a quick Google search might get you hundreds of articles, influencers, and AI summaries with different recommendations. But with Kaiser Permanente, you can get high-quality healthcare as easily as ordering a ride. Simply go online or sign into the Kaiser Permanente app to connect with your care team. Make an in-person or virtual care appointment, order prescriptions, or manage your care. When you need care, you can talk to a clinician in person, by email, over the phone, or by video. If you prefer to visit us in person, it's easy to schedule an appointment at a location near you. With our national network of locations, doctors, and specialists, you can get timely primary care appointments and quick lab results. Same day, next day, and weekend appointments are available at most locations, and because services are connected, many Kaiser Permanente facilities have pharmacies, labs, and other services all in the same building, so you can get more done in fewer stops. It's easy to refill prescriptions online, on the Kaiser Permanente app, in person, over the phone, or by mail order. You can have most delivered to your home with same-day or next-day delivery, or order your prescriptions for same-day pickup. Get refill reminders or alerts when new prescriptions are available to order via text, mobile app, or email. You can also place some orders by responding directly to our text message reminders. We'll provide status updates via text or email about shipping, delivery, or pickup information. With Kaiser Permanente, you're covered for urgent and emergency care anywhere in the world. If you're planning to travel, we'll help you get vaccinated, refill prescriptions, and stay on top of your health while you're away. If you need to refill a prescription while traveling, you can get your medication refilled at a local pharmacy. If you need emergency care, always use the emergency services where you are, and contact Kaiser Permanente when your condition is under control to make your care team aware of your condition and discuss your treatment. Now let's go into more details about the Kaiser Permanente plan options available to you, including high-level coverage amounts. You can choose from the following medical plan options. Let's take a closer look at the high-level coverage amounts of your plan options. For specific information about your covered health plan benefits, limitations, and exclusions, please review your evidence of coverage or speak to your benefits administrator. If you need additional time to review this information, press the pause button in the lower left-hand corner of the screen at any time. Here is an overview of the plan option being offered to you. Chiropractic and acupuncture care services are also included. These services are covered when provided by an American Specialty Health Plan participating provider. You can obtain chiropractic and acupuncture services without a referral from a plan physician. Call or visit the website on the screen to find a participating provider near you. The One Pass Select Affinity program provides in-person and digital fitness memberships that range in pricing starting at $10 per month. In addition to fitness, members who sign up with One Pass will have access to healthy meal deliveries with Walmart Plus. And enrolled members will have access to the Affinity Musculoskeletal program, which provides discounts on chiropractic, acupuncture, and massage therapy. For more information, visit onepassselect.com. Employees can choose the plan that fits their needs. This slide illustrates the different membership levels and the costs associated with each. Good health goes beyond the doctor's office. With Kaiser Permanente, you get a wide range of personalized support for your mind and body, designed to fit seamlessly into your lifestyle. For your mental and emotional health, Kaiser Permanente provides clinical and support services for a wide range of conditions, including anxiety, stress, depression, addiction, and autism spectrum disorders. Our mental health team includes psychiatrists and psychologists, as well as marriage and family therapists, addiction medicine physicians, and medical social workers. And you don't need a referral for mental health care within Kaiser Permanente. Practice self-care with popular apps to reduce stress, improve sleep, and manage overall mental wellness. For your physical fitness and lifestyle, here are some of the wellness resources to help you stay healthy once you register at kp.org. health classes. Choose from a large variety of classes and support groups offered in person and online. Some classes may require a fee. Online wellness tools. Join a program to help you lose weight, reduce stress, quit smoking, and more at no additional cost to members. Find helpful videos and articles, health calculators, podcasts, recipes, and more. Finally, wellness coaching by phone. Get one-on-one guidance and support from a dedicated wellness coach who can help you set goals, stick to them, and most importantly, see results. And you can do it all from the comfort of home. Partnering with a wellness coach can help you manage your weight, reduce stress, quit tobacco, eat healthier, and increase activity. You can sign up through your benefits administrator over the phone with a Kaiser Permanente enrollment specialist, or by entering some basic personal information at kp.org/choosekp. After you sign up, we'll reach out to help make your enrollment as easy as possible. We can help you transition your care, easily move prescriptions so your treatment is uninterrupted, and find a care location that's close to your home, work, or school. You can choose your new doctor, browse doctors by location, and see details about their education, specialties, languages spoken, and more online. Choose your doctor based on what's important to you and change it anytime. Within 10 days of your start date, you'll get a personalized welcome book in the mail, a welcome call from us, and your ID cards. And once you make your first appointment, you'll get a pre-visit call. Thank you for your time and attention. Today we reviewed our integrated quality care, digital care options, and membership perks. Please visit kp.org to learn more. Now you have the information you need to select with confidence Kaiser Permanente as your health plan.
Hello, everyone. Welcome back. Thank you for listening to that pre-recorded presentation. We are now going to enter our Q&A session, which we've got a few coming through on our Q&A panel right now. I invite all the vendors and the health plan and vision reps to come on camera and remind all of our members that we do not want to add any personal health information like your social security or DSW numbers or conditions into the chat, as this is a public forum webinar. And we'll be ending the webinar promptly at 4 o'clock. So get your questions in. I'm going to scroll back to the very first questions, read them aloud, and then let our health plan representatives read those responses out loud. So the first question comes in from Elaine. Elaine asked, will the recorded presentation and slides be available after this presentation? And if so, where? So we have HSS staff put in the chat, but I'll hand that over to either Sonali or Jay, and coming on camera too, so we can help see who you are.
Sure, yes. All our webinar videos are going to be available as if you are registering for the webinar. So it's the same place. You go onto our events landing page, and then you go to the calendar, and you should be able to see this pre-recorded video on the bottom of that web page. And I'll drop that landing page again on your screen just so you have it.
Thanks, Jay. The next question comes in from Sharon. So the question is from HSS, will the transit benefit continue next year if I don't do anything? And so several of our HSS staff responded. I'll hand it over to them. And that might
I can take this one. So this is a webinar specifically for our Unified School District employees. For those who are not Unified School District, you're going to want to connect with the Department of Environment, and I believe a link was provided to you. For those who are Unified School District employees, you're going to want to connect with your benefits office, and they will walk you through transit benefits. Those are not administered by SFHSS. A great question, though.
Thank you. The next question came in from Bob asking what states or regions are served by Kaiser Permanente Northwest? And I'll hand this over to our Kaiser representatives.
Can you repeat that question one more time, please?
Yeah, this is from Bob, and Angela is going to be responding. The question was, what states or regions are served by Kaiser Permanente Northwest?
You can actually look up the locations by going to kp.org/locations, and I'll look up a link to be able to share with you as well.
And I think your colleague may have gotten there quicker. Yep, go ahead.
Oh yeah, I already put it in the question, the link to search facilities, and the Northwest mostly serves Portland and Vancouver, and we also have a facility in Eugene, Oregon.
Great, thanks. Okay, the next question comes in from Evangeline. It looks like this is a question for HealthNet. How to find the list of providers in the HealthNet canopy? And this member did share a link, but I'll hand it over to HealthNet representatives. Freddie.
Yeah, this is right. So the best way to go ahead and find providers is through that website that was in the presentation. So that's healthnet.com/SFHSS. And then through the banner at the top, you'll see the word enrollment. You click on that, and that'll take you down to our find a provider search. And that's where you would look for providers. Canopy has their own website as well. And that is, Emma, do you have that website real quick you can share with the group?
Yeah, it's just canopyhealth.com /find a provider. I can drop the link in there as well.
So that's another option. And both platforms are in sync. But that's just, we have basically two provider search engines, if you will.
Great, thanks, Freddie. The next question comes in from AJ. Where can we locate the premium information? And that's geared towards HSS.
Yeah, we have our digital benefits guide that I included on that link. It's on page 8. There's a summary of benefit plan where you can see some premiums on there. Again, you can go on our landing page, which is sfhss.org/OE, and you can follow the links there. But again, if you can click on that link, I just typed in the chat box there, just click on it and it'll take you there. Page 8. Thank you.
Thanks, Jay. So the next question came in from Michelle. Are the work terror choices made last year also rolled over if we do not update our open enrollment choices? This one's for HSS.
Take that one too. So again, work Terra voluntary benefits are only available for city and county employees, not for USD employees. Any voluntary benefits for USD employees, please do connect with your benefits office. For work Terra, anything that you are selecting or had selected for plan year 2025 will roll over with a few exceptions in terms of the provider for your long-term disability, group life that is employer paid, voluntary life insurance that is employee paid, and short-term disability. Those vendors are going to be changing. Long-term disability, short-term long-term disability, supplemental life, and group life are going to be switching over from the Hartford to New York Life, and short-term disability is going to be switching over from MetLife to New York Life. But if you don't want to make any changes on those plans, you do not have to take any action. I did include a link in the response to our open enrollment webpage that is specifically for city and county employees for you to be able to see what is changing specifically with those 4 policies.
Great, thanks, Olga. The next question comes in from Alex, and it's for our HealthNet and Canopy reps. Does Canopy overlap with Blue Shield in Marin? Emma, you were able to respond to that, or Freddie? Yeah.
Yes, so Canopy Health, we partner with health physicians up in Marin County.
Okay, great. Thank you. And we'll move along to the next one. This one is from Bob, who has a retiree question, which I'm not sure we'll be able to address specifically, but let's see. I'll be retiring next year and evaluating the Access Plus versus Blue Shield PPO. And as an employee, premiums for the PPO program are higher than Access Plus. But as you retire, the Access Plus premiums are higher. Can you explain why to this? And it looks like Olga shared a response. That's with HSS.
Yes.
Yeah.
So rates for employees and retirees are set differently. There are considerations for the city charter that go into play along with MOUs for active employees. So there is going to be a slight difference depending on which union you're with across the board for active employees. And then in considering the retiree rates, there's also city charter that goes into play depending on the years of service. So all of that put together really make up our difficult and complicated rates that we have for a variety of different groups that we administer benefits for.
Thanks, Olga. All right, the next question is from Sharon, and it's a question for Canopy Care. So 2 doctors in the 1 medical offices in this member's neighborhood is on the provider list, but one no longer is there. The 1 medical staff said that this member would have to sign up for a limited membership in order to gain access to the patient portal. Is this membership okay to activate since 1 medical is a concierge business? And it looks like Emma responded. I'll give it to you.
Yeah, so I just wrote that members, you don't have to pay the membership fee just to be assigned a PCP, but they won't have access to all the enhanced services that I listed. So if you don't want to pay the fee, then they would have to state that you don't want the full membership, which I guess they could refer to as a limited membership.
Okay, great, thank you. The next question is from Paula. Did the Blue Shield video say that 1 can have 3 therapy appointments in 6 months? So wanted to confirm that. It looks like Adam from Blue Shield responded. Go ahead, Adam.
Yes, that portion of the presentation was referring to the free program called Life Referrals 24/7, which is available to all HMO and PPO members, where you get 3 free visits basically in a 6-month period. But if you're accessing your mental health benefits for therapy, those number of visits and how often you go is determined by you and your therapist, and those are not limited.
Great, thanks, Adam. The next question came in from Bob. Blue Shield Trio and Access Plus utilize organizations like Hills Physician and Brown and Toland. Under the PPO program, are subscribers assigned to one of these networks? That's another one for Adam.
And the answer is no. PPO members, if you're enrolled in a PPO plan, you do not have an assigned doctor or medical group. You can choose to see any doctor you want that's in or out of the Blue Shield network if you're in the PPO plan. Just keep in mind, if you do see a provider that is not in the Blue Shield network, you would be accessing your out-of-network benefit, and you do have a higher cost share. So we recommend you try to stay in network. But PPOs don't operate like HMOs, and you're not assigned a primary care or a IPA. You choose.
Great, thanks, Adam. The next question came in from Perva. Did the premium rates for the Blue Shield of California go up for the 2026 compared to the 2025 plan year? And it looks like Olga, I put in a link. Go ahead.
The links are there. So depending on which union you're with, you may see a change in the employer cost as well. But it all is relative to depending on which union you're with. But all those comparisons for both USD employees and non-USD employees are in those links that I provided.
Great, thanks, Olga. I'm also looking at the time. It's 3:55, so we will have 5 minutes left and end promptly. I know Jay will be dropping in some more links just to look at and be aware of after the webinar is over. So the next question, though, comes in from Paula. Is there physical therapy in Marin County? Which is a bit of a general question. I'm not sure if one of our health plans want to address that, or we can wait for further clarification from the requester.
Well, I can speak to Kaiser Permanente. So we do have physical therapy in Marin County, specifically in San Rafael. So the first connection again would be with your primary doctor, who would then make that connection for you.
And for Blue Shield, it would be the same. If you're on the HMO plan, you would want to connect with your primary care. I'm fairly certain there is. And if you're on the PPO, you would just need to look for a physical therapist on our website.
Great resources. Thank you. All right, the next question comes in from Perva, and this is also about premiums. So are the premiums listed on the 2026 San Francisco Unified School District Health Benefits Guide in the PDF, are they monthly or are they per pay period? That may be for HSS, Olga, if you're seeing this question from Perva. The question is, are the premium rates listed in our benefits guide, are they bi-monthly or pay period?
Sonali has put in a link. They depend on which type of employee that you are. So if you're a monthly employee, your premiums are taken out monthly. If you are a biweekly employee, they're taken out biweekly. And so the breakdown for those for the different classifications of employees are listed on the rate sheet.
On Olga, it looks like Perva is from DPH, so the USD guide may not be relevant. Could we share the CCSF guide with Perva?
Yes, absolutely. And that was shared in one of the other employees' question, another member's question that had asked that. But yes, we will go ahead and drop in the active rates. So for city and county employees, you are paid biweekly, so your premiums are deducted biweekly.
Thanks, Jessica, for jumping in there, and Olga for knowing where the resource is to drop it in. All right, we've got a few more before the top of the hour. This one comes from Alicia. Do we need to press submit for our medical and vision coverage, since there's a button on the DSW site that has a submit button?
So this is for USD employees, there is a little bit of differences in the different benefits that you are enrolling in. So if you are enrolling in your medical and vision benefits for next year, or if you are looking to extend your benefits and not make any changes, there's no action that you actually need to take. If you are making changes to any of your benefits that are not medical or vision benefits, you will absolutely have to take an action. I believe it's an active enrollment for all of you for those other benefits. Medical and vision is a passive enrollment as it has been in prior years. So there's no active step that you need to take. But if you are making changes, it will not make a difference. Sorry, if you're not making changes, but you're going through the system and evaluating what you're enrolled in, hitting that submit button will just reinforce that that is what you're looking to enroll in. But if you don't, again, for medical and vision only, it's a passive enrollment. Everything else you do have to take an active step on. And for support on those things, please do connect with your SFUSD benefits office.
Thanks, Olga. The next question comes in from Alex, who says, briefly, what are the differences between the Blue Shield Trio and Access Plus in West Marin County? And it looks like, Adam, you jumped in there quick with some links, but go right ahead.
Yeah, the only difference, again, between the Access Plus and the Trio is the provider network. So if you're looking for doctors in the Trio plan, you would go to the link that blueshieldca.com/Trio SFHSS. And if you're in the Access Plus, you would just go to the blueshieldca.com/Network HMO. Benefits are the same. Only the network is different between the two plans.
Great. Thanks, Adam. The next question came in from Maggie regarding Kaiser Insurance. How can I find that chiropractic and acupuncture through American Specialty Health Plans of California? Any websites? And it looks like, Angela, you dropped one in.
Yeah, I dropped that in as well as the phone number there directly to the customer service so you can find a provider.
Great. All right. We are at the top of the hour. So thank you so much for joining, everyone. Jay did drop in another link that'll leave you with direction with lots of resources on our website. And remember to submit all your changes for open enrollment before October 24th at 5 p.m. Have a wonderful rest of your day. Thank you.
Bye, everyone.
Bye.
Thank
Thank
you.
you.
Bye, everyone.
Thanks.